Hi there, integrative nutrition health coach and eco pastry chef Lasia Cahoot here, and today I'm talking to Louise Comtois from d'Avignon Digestive Health Center, who is a colon therapist and someone who I am seeing on a pretty regular basis these days as I try and clean out and heal and strengthen my gut, which is totally connected to overall health. So we're going to talk today a little bit about what goes on during a colonic so that people can kind of breathe easy, because there's this, I know I had it before I came to see you the first time, this sort of apprehension, almost fear of, oh my God, what happens? And then once you actually go through the process, realize how amazing and powerful it is and how much you can learn from every session, how sessions are different from session to session, and how it's probably different from person to person depending on what they're dealing with. So before we start talking about what goes on during a colonic, what I'd like you to tell the folks a little bit about is, how did you get to colon hydrotherapy? What brought you just yourself? What was your personal thing that led you here?
About 15, 16 years ago, I'd been having many digestive issues, not the least of which was extreme constipation. Mm-hmm. And I'd also had other health issues that the medical community didn't seem to be able to help me with. Mm-hmm. So about 16 years ago, I went to study holistic nutrition. While I was there, I learned many things that started to help me to begin to heal. The constipation issue, however, was not resolving. Mm-hmm. And one day I happened to be sitting in the classroom, and there were two other classmates sitting in front of me, and one was describing to the other her first experience with colonics. So I'm listening to this, and I can hardly believe what I'm hearing. And it must have been burning a hole in the side of her head with my eyes, because she turned to me and I say to her, "That's barbaric." Ah. And this was Estella. And she says to me, "Oh no, Louise, you don't understand." So that's all I remember about that conversation. And I think I'm, just put it out of my mind. Yeah. Fast forward, I'm not sure when, but sometime later, I was at home. And the constipation had gotten so bad that I couldn't sit. Mm-hmm. I couldn't put my pants on. And I was so full here and yet hungry here. So I couldn't eat because I was too full, but I was very hungry. So I called in sick to work and thought to myself, well, I could either go to the hospital or I could try one of these colonic things. Mm-hmm. Given my history with the medical community, I decided to opt for a colonic. Mm-hmm. And so I did. Mm-hmm. And my first session, some people are, not comforted to hear, but my first session was not the best experience in the world. But what happened was that I understood that the problem was me. I understood that the problem was my bowel, understood how this was supposed to work, and that if I kept at it, that it would help me. Right. And truly and surely, that's what happened. It did help me. So afterwards, just realizing that there was a lot of, there were misconceptions, people didn't understand colonics, people were fearful of colonics, and so for me it became, well, this was so helpful to me. What I want to do is bring it to people and for them to decide, but in the meantime, giving them, as far as I'm concerned, the right information about it. So what are colonics really about? Are there health risks involved with colonics? What is it? When can it be helpful? And what kind of digestive issues can it help you with? And that sort of that's where it started for me, was just from my own experience. Having had that initial reaction that this was, a scary thing, that it's barbaric, you shouldn't do this, getting to a place where seeing that no, actually this is quite gentle and yet very powerful. Mm-hmm.
So when I came to you the first time for my very first colonic, it was at the urging of my naturopath. At the time, my husband and I were on a detox, a 3-week detox, and even though I felt pretty okay in my head, I was very aware of the fact that I was constipated and I had had barely any bowel movements for 2 weeks. And for me, that was crazy. Like, I was used to going, 1 to maybe 3 times a day. There would be different stuff happening, but still, like, basically things that were coming in were more or less going out. And so to not be going to the bathroom for almost 2 weeks was so difficult. I was super distended. I felt like I was pregnant. That what you were talking about, kind of, not feeling nourished because you were afraid to eat. I was getting to that point, and meanwhile, my husband was having his morning smoothies and eating his fermented foods and having no problem. And so I told my naturopath, and she said, you have to go for a colonic. You have to get that stuff out of you. So after years of hearing these near religious experiences from friends of mine who'd gone for a colonic and then saw the light and were transformed, I thought, okay, I'm going to do it. And so I contacted you because you and I had met a few years before under different circumstances, and I, even at the time before I'd gotten into digestive health, was really intrigued by what you did. And so I thought, I want to reconnect with Louise, and this is who I want, to walk me through this first experience. I was very nervous. I had that apprehension. I had that fear. And from the very first phone call and conversation with one of your partners, Marnie, to coming in here and then talking with you and you walking me through the process, just that setup really put me at ease. And then once we actually went through the process, I felt like the stuff that I was learning about my body and what you were telling me that you saw as you saw the stuff coming out of my body was absolutely fascinating and like pure gold from a health and wellness perspective for me. So I've been coming to see you on a fairly regular basis for the past several months. And even though it's kind of up and down, or maybe 3 steps forward, 2 steps back, the sessions are different from session to session. If I step back and look at the big picture, what's going on here is much better than the way it was when I first came to see you. And I'm noticing differences in my skin, in my sleep, in my alertness. Like, there's just so much stuff that even I'm at the tail end of a cold right now, and I had a colonic last week, and even in the middle of being sick and having this bug, whatever it is, I felt so much better at the end of that session because all of this gunk just got cleaned out right away. So what I would love is I would love you to walk us through what happens when a client walks in your door, whether it's the first time or not, and just sort of demystify a little bit for the folks out there what goes on during a colonic, so that they can see that it doesn't have to be a scary thing. And even though somewhat invasive, that it actually is such an incredible tool to help heal, repair, and really learn about what's going on in your body and how you can make improvements. So what happens? Someone walks in the door.
So the first time somebody comes in, we have them fill out a health history questionnaire that we then go over with them. And that just lets us know a little bit about their health history, their eating habits, their diet, their lifestyle, their level of stress, their level of happiness, believe it or not, their constitution, so just where they're at in the world and how they got there.
Right.
Because those things have an impact on us physically and physiologically. So the more we understand about somebody, then the more we can make sense of what's happening with them, what we see during the session.
Right.
So we go over that. Once that's done, there's a brief abdominal massage on a slant board. So what that means is that the person's lying on the slant board, their head is down and knees come up a little bit. And what that does when we're doing the massage is it brings the bowel up a little bit. So we're able to feel a little bit better the tone, the shape, if there are any irregularities in what it's supposed to feel like, if we feel for accumulations, or if there's hardness or lots of gas or inflammation. So again, it just gives us more information about what we're dealing with. And then once that's done, we go ahead with the colonic. So a person's lying on a table, such as this one. And to start off, they're lying on their left side, facing the wall.
And is there a reason for lying on the left side?
The reason to lie on the left side is because we do the insertion of the proctoscope. This is the proctoscope.
Right, okay.
So this is essentially the tool that allows the colonic to happen.
Okay.
Okay, so the proctoscope, I think initially sometimes might seem a little frightening to people. However, the diameter of this is no bigger than what a normal size stool should be, so it doesn't stretch or damage or bother the area. We put some water-soluble gel on there so that the insertion is smooth. And typically the proctoscope is inserted about 3 inches. So the rectum for most people is between 4 to 7 inches long. So once it's inserted, it just sits there, doesn't move. This is a hard plastic. They're single-use disposables. We use them once. They come sealed in a package, and we open the package at the start of the session. And once the package has been opened and the proctoscope has been used, we just dispose of it afterwards.
Right.
So this doesn't disintegrate. And there's one of the concerns I want to mention that people have or have heard about colonics is that you can puncture your bowel. It would be near impossible because this goes in straight and just sits there. So what I liken to is that it's like saying you could puncture your cheek with your toothbrush.
Okay.
That would be near impossible.
Okay.
And if nothing else, you'd get yourself out of the way.
Right.
So if this was going in not in the right spot, people fidget.
Yeah.
So so that's, as far as I'm concerned, it's a non-issue.
Yeah.
So what happens then, once the proctoscope is inserted, there's actually a small tube that's attached to this end right here, and that's where the filtered water comes in.
Okay.
Okay, so the filtered water will be going in this way through the proctoscope, but once the proctoscope is inserted, this part comes out.
Right.
So the water tube is attached here. You see there's a hollow there. A second tube gets attached here. So you've got the filtered water coming in, and the wastewater will actually come out this way through a tube.
So this is very much almost like a sewage pipe, like the where there's water coming in, say, you know, from the rain or whatever, and then it's going to wash out and
it just
go
washes
somewhere else.
out.
Yeah.
This is called the system that we use is called passive gravity closed system. So there's no mechanism to apply pressure to the water going in. It just flows from a tank into the body. So it's very gentle. It doesn't go in. It doesn't go in hard, right? It just flows in nicely, and then the water just moves out through the tube. And that's what that means, that it's closed, it's contained. So there's no mess or there's no issue. I think that's something else that people may not realize is, well, what do they do with it? Where does all this stuff go? Basically, it goes in a tube and it's gone. It's kind of like flushing your toilet. It just goes into the sewage.
But as the stuff is coming out of the tube, there's something that we may not be able to see, but there's a mirror above the bed.
Yes.
That when we are lying on, you know, the table on the table, we can see, if we choose, what is coming out of us, and you can say, this is gas, this is fermentation, this is yeast, this is stool, this bits of undigested food. And it really, I mean, it's so much information that is passing through, and I find it fascinating to see. And I know that even if I'm tapping, which I sometimes do, to help encourage, you know, my body to relax and to release more easily, I still am asking, you know, Louise, what's coming out? Because at that point I don't have my glasses on, so I can't see. And so so you can see, and so what do you? What
the reason it's helpful for people to see because it's impossible to describe.
Right.
But everything that you mentioned, but more specifically at times the quality of the stool. Is it fatty stool? Is it dry stool? Are there undigested pieces of food in there? There's certain indigestible fibers which you would expect to see. That's normal. But sometimes people will have literally chunks of food in there. So it has to do with whether they're not chewing properly, if they're eating too quickly. So there's all kinds of indicators. That's what we call them. We don't diagnose anything, but we give you feedback about what we're seeing. And then based on that information, we can talk about, well, what is your diet? What is your lifestyle? And what are your health goals? And how can we achieve those?
I know that with me, there are a few things that I have started doing since I started coming to see you a few months back. One of the first things, I think, was we talked about HCl. Because there were bits of undigested food and I was experiencing bloating. At the time I was playing around with a low FODMAP diet to try, which is another topic for another day, to try and help with the bloating that I was feeling, like within minutes of eating certain foods that are supposedly so healthy and nutrient dense, but because there is stuff that still needs to be repaired and healed, my body wasn't able to deal with that kind of food. So I started taking some HCl tablets to help increase the acidity in my stomach, to help break down the food. I think probably one of the next things was you wanted me to start taking some psyllium so that I could bulk up, and so that, you know, the stuff was passing through sort of like in a nice bulky form. Because at the beginning, even though I may have been going to the washroom pretty regularly, I had these like long, skinny, pencil thin stools that looked more like snakes or something, which means there's a blockage.
I don't call it a. If you actually had a blockage, you'd be in serious trouble pretty quick.
Yeah.
So typically it represents constriction or a narrowing in the bowel.
Yeah.
So that you still have movement, but it's somehow impaired.
Right. Okay. And so that has helped. More recently, I started taking Triphala to help soften the...
Triphala is actually a tonic for the bowel, so it actually helps with the bowel to contract so that things keep moving. So it's a tonic with laxative-like properties. It's not a laxative proper, so people are very afraid of laxatives, as they should be, but Triphala is a little bit different that way because it's, like I say, it's not a laxative per se. You don't become dependent on it, and actually what happens is because it helps to strengthen the tone of your bowel, you require it less. Most laxatives, it's the opposite. Is that if you use them regularly, you do become dependent because they're the ones doing the work for you, rather than your bowel doing the work for itself. Triphala actually helps your bowel do the work for itself, as do colonics proper, and that's one of the reasons that you don't become dependent on colonics. It's a strictly mechanical process. There's nothing chemical. There's nothing added to the water. What the water does is it prompts your bowel to contract. So I liken it to taking your bowel to the gym. And also your bowel likes that. Your bowel gets to do what it wants to do. There's no coercion here. There's nothing that we're doing that violates the sensibilities of the bowel. If anything, we're working with it. And the bowel knows that and appreciates that and cooperates. I have people say sometimes when things are slow to move or slow to start, typically it's a lack of tone for various reasons. So we're trying to rebuild that tone, and people say, oh, my bowel's lazy. Typically, people are not lazy when their needs are met, or when they don't have an issue that is preventing them from being productive. It's the same thing with our bodies. Our bodies are not inherently lazy, right? Certainly our organs are not inherently lazy. If you give your body what it needs, it will want to do what it's made for, what it's good at. And colonics help your bowel do that.
And when you're lying on the table and your body is doing what it's supposed to do, it's a bizarre feeling. I mean, the first time I was here, I thought, oh, Louise is doing that. And you said, no, that's you. Your body's doing what it's meant to do.
That's right. And you typically, over time, you see that peristalsis, it's called, you see that become stronger. Right? Your bowel gets it, and it's like, oh, I know what we're doing, I get it, this is great, let's go. So over a period of time, you actually see it get stronger.
Okay, so there's all this information that's happening, the water is flowing, the stuff is coming out of the body. About how long is a person on the table?
Typically, you're on the table about 30 minutes. We do what we call adapted colonics sometimes, so for people who may be a little bit older, or people who have a certain frailty that doesn't necessarily prevent them from having colonics. So it may be shorter. And we also have, this is a regular size proctoscope. We also have a smaller one. It sort of reduces the amount of water that'd be going in, entering into the bowel. But for the average person that we see, we use the regular proctoscope, and you're on the table for about 30 minutes. Sometimes the bowel is the bowel dictates what goes on, so it's not unusual that we'll keep people on the table longer.
I remember being on the table a really long time.
Sometimes that can happen.
Okay, and so about 30 minutes on average, and then what happens?
And then obviously we remove the proctoscope, and the person goes to the washroom to evacuate.
Okay, and there is a toilet right in the same room, and so you leave the room, the client has privacy. And just sit here until everything has come out. And one of the things that I noticed right away was there's a stool. We put our feet on a stool, not just dangling on the floor like we normally would. Why are we doing that?
It brings your knees up above your hips. That's the idea. The natural position for eliminating is squatting. And what that does, if you picture squatting, your thigh comes up to your abdomen. That creates pressure and warmth. So it sends a signal to your bowel that it's time to move. With the modern toilet, we don't get that signal.
Right.
And there are other impediments too to having regular bowel movements. We typically are under stress, and that will inhibit your body's signal to empty. And we don't eat consistently the types of foods that go through your system on a regular basis that form nice, clean, healthy stool.
Yeah.
So there's all kinds of reasons why things don't move as well. Bringing your knees up actually does help to send a signal that it's time to move. It's also actually a more comfortable position. It does feel like there's less strain or pressure.
Yes. Yeah, definitely. Okay, and then so the person gets dressed, go outside, and then there's usually a little water and a little something for us on the counter.
There's a little probiotic afterwards. And that brings up an interesting question, because something else that gets said about colonics is that you shouldn't have them because it'll empty out all of your good bacteria. There's a couple of things about that. If you put water in your mouth and just spit it out, you're not going to get rid of all the bacteria in your mouth. So introducing water into the bowel, and contrary to what people think, the water doesn't actually travel all the way to the other end of the bowel. We can prompt peristalsis to occur by just introducing water, most often even to the end part of the bowel, the ascending part of the bowel, and maybe halfway up to where the transverse part of the bowel is. But typically you're not going to get water all the way through.
Right.
So just introducing that and eliminating what's there, you're not going to get at the probiotic that are actually working on your body. You're going to eliminate the waste, which breed the wrong kind of bacteria, the wrong kind of microbes. That's what you want to get rid of.
Yeah, okay.
So to replenish, it's estimated now that we have about 100 trillion healthy bacteria in our digestive tract. So we're not really overly concerned that you're going to lose that. The other thing is, typically, if that were to be true, those bacteria are very much involved in immunity. And what we see with people who have colonics and who get rid of the accumulated waste is that their immune systems actually improve. So they're less likely to get sick or catch colds. If it were true that you were eliminating all this good bacteria, we would leave people vulnerable to getting sicker.
Right. Yeah.
And that's not the case.
Right. Okay, so I mean, I know I could keep talking about this with you for hours. I feel like sometimes we have talked about stuff for hours. But I think that probably will give folks a really good idea of what goes on here. Before you let people know how to get in touch with you and where Davignon is, you also offer coffee enemas here. So maybe just quickly you could talk about the difference or why someone would go for a coffee enema versus the colonic.
The colonics are really for cleansing and strengthening the bowel. The coffee enemas are for cleansing and strengthening the liver.
Okay.
So you wouldn't, when people call us to talk about that, we recommend that you do colonics first to make sure that you've got a clear and strong bowel, because you don't want to be causing a dumping of waste from your liver into a congested bowel.
Right.
So that's something that will work out with people. Another big difference that isn't so much in terms of the health benefits, but colonics are very tricky to do at home, whereas coffee enemas are very easy to do at home. So we can work out a protocol with people based again on their health goals, of how they might be able to do that at home.
Okay, all right, great. Okay, so just before we go, if you could just let the folks know how they can get in touch with you, whatever information you want to give out.
Sure.
Go ahead.
The Davignon Digestive Center's website is digestivehealthcenter.com. So you can access us there. The telephone number, 416-465-1222.
Okay, and where are you guys in
We're
the city?
located in Greektown.
Okay.
So Broadview and Danforth. We're on the Danforth, just a little bit east of Broadview.
Okay. And upstairs.
So very accessible by TTC. Yes, we're upstairs from the Rogers store.
Yeah. Okay, that's great. Louise, thank you so much for this conversation today.
Thank you.
I'm such a huge fan of you and of the process and of digestive health, period. So thank you, everyone. I'm Lastia Cahoot, Integrative Nutrition Health Coach and Eco Pastry Chef. Today we've been talking with Louise Comtois of Davignon Digestive Health Center. And thank you so much for watching another episode of Eat Well, Be Well TV. Until next time, eat well, be well.